Project 6A. Prepare to administer an injection. In all cases when preparing syringes of different medications, or if you are not administering the medication immediately, clearly label the syringes opposite the volume markings. Write the type and concentration of medication, for instance, ketamine, 1 milligram per milliliter. You will need a 10 or 12 milliliter syringe with an attached 18 to 21 gauge needle, a 10 milliliter glass vial of sterile water or normal saline, a 10 milliliter plastic vial of sterile water or normal saline, alcohol wipes, sharps container, sticker paper or a strip of strapping for labeling, a pen. Follow these initial steps for drawing up fluid or medication from any vial. Clean the work surface with an antiseptic solution. Open a clean work surface cover. Gather all the items to be used with the outer packaging intact. Prepare your hands hygienically. Donning clean gloves is optional but strongly recommended. Open the syringe on the work surface cover. Partially open the needle at the hub end. Connect the needle to the syringe and place on the cover. Tear open an alcohol wipe and place on the work surface cover. If you need to draw up medication from a glass vial, follow these steps. Hold the vial upright between your fingers and swivel the vial 2 to 3 times in a circular motion in order to ensure that all medication is in the bottom of the vial and not in the top. Do not flick your finger against the vial as you may break the vial and injure your finger. Identify the small dot on the vial and face it toward you. Hold the main body of the vial between the thumb and index finger of the one hand and the top part of the vial between the thumb and index finger of the other hand. Crack the vial open by bending the top back in a single definite action. Then, place it upright on the work surface. Carefully remove the needle cap from the syringe. If you are using a safety needle, retract the protective cover from the needle and then remove the straw-like sleeve. Do not touch the needle. Turn the vial horizontally and insert the needle into the vial. Gently pull the plunger and allow the medication to fill the syringe. Withdraw the required amount of medication as specified. Avoid drawing air by keeping the needle tip below the fluid meniscus of the medication. Withdraw the needle from the vial. To get rid of air bubbles, hold the syringe vertically with needle pointing up. Tap the syringe gently to move any air bubbles toward the needle. Gently push the plunger to remove the air and possibly bubbles mixed with a couple of droplets of medicine. Prepare to administer the medication using the appropriate route. If you are going to give an intramuscular injection, appropriately discard the needle used to draw up the medication and place a new needle, preferably a safety needle, onto the syringe. Some medications are supplied in a powder form within a glass vial. Use the same steps as above, but first dissolve the powder in an appropriate solvent before drawing the medication. How to draw up medication from a plastic vial. Open the plastic container by giving the cap a 180-degree twist and open action. Carefully remove the needle cap from the syringe or retract the protective cover and remove the straw-like sleeve from the safety needle. Do not touch the needle. Turn the vial horizontally and insert the needle into the vial. Gently pull the plunger and allow the medication to fill the syringe. Withdraw the required amount of medication as specified. Avoid drawing air by keeping the needle tip below the fluid meniscus of the medication. Withdraw the needle from the vial and get rid of any air and air bubbles in the syringe. Prepare to administer the medication using the appropriate route. How to draw up medication from a glass vial with a rubber membrane. Note that this type of vial is not supplied in your kit. Carefully remove the protective cap from the vial and swab the top of the vial thoroughly with a fresh alcohol wipe, allowing time to dry. Determine the volume of medication required in milliliters, then draw in an equal amount of air by pulling back on the syringe plunger. Carefully remove the needle cap from the syringe or remove the protective cover from the safety syringe. Insert the needle into the center of the rubber membrane of the vial. Turn the vial upside down and slowly inject the air from the syringe into the vial of medication. Gently pull the plunger, allowing the medication to fill the syringe, and withdraw the required amount of medication as specified. Withdraw the needle from the vial and get rid of any air bubbles in the syringe. Prepare to administer the medication using the appropriate route. Directions for using a vial with a powder and a solvent compartment. Note that this type of vial is not supplied in your kit. Press down on the plastic activator to force diluent into the lower compartment. Gently agitate to effect solution. Remove plastic tab covering the stopper. Sterilize top of stopper with an alcohol wipe. Insert needle squarely through center of stopper until tip is just visible. Invert vial and withdraw dose.